How's it everyone who's watching this? This is my 71st video on my channel, and today we're going to be continuing Character Analysis by Wilhelm Reich. In particular, we'll be looking at the beginning of chapter 4, fittingly titled On the Technique of Character Analysis. Here, he elaborates on what exactly the character is, how he proposes analytic technique should proceed, and other technical details like that. As a bit of a warning, there is some minor reference to sexual topics in this episode. Now, without further ado, let's get into it. Reich begins by essentially recapping what we discussed in the previous two episodes of the series. In psychoanalysis, there are three main ways of looking at metapsychology: the topographical, dynamic, and economic points of view. The first concerns the relationships between the different layers of the psyche. In therapy, this manifests as trying to make unconscious elements conscious in order to allow the patient to work through repressed material. Originally, psychoanalysis was almost completely focused on topography, meaning that treatments simply evolved interpreting things immediately as they came up. However, this was problematic. It left the second dimension up to chance, that of dynamics. With this, as illustrated here, the focus is on forces in the psyche and how they interact and get blocked. By ignoring dynamics, topographical psychoanalysis was unable to ensure the effectiveness of treatment. Whether or not interpretations would allow blockages to become undone was simply up to luck. In practice, the dynamic factor implies having the patient experience what is being brought up from the unconscious, instead of simply having an intellectual knowledge of it. Rather than the focus lying on the material the patient provides, the dynamic side of psychoanalysis is more interested in resistances, the things that cause those blockages in the first place. Connecting back to what we talked about in the last episode, he explains that the therapeutic formula changed quite drastically with this in mind. Topography is very easy to deal with. Just explain what appears. However, recognizing the existence of resistances complicates everything. Now you can't necessarily just trust what's being said. Repressed elements want to stay repressed. So to get rid of them, you have to break down their defenses in a consistent manner. Nevertheless, this is easier said than done. In his own words,
"In pursuing this plan, however, a difficulty arises in most cases, a difficulty which we have not considered in the foregoing presentation."
This brings us to the first subsection, titled The Inability to Follow the Basic Rule. Here, as the title suggests, his attention falls on the difficulties associated with getting a patient to truly free associate. For most forms of psychoanalysis, the person being analyzed has to release a stream of thoughts without any filtering to allow unconscious elements to surface. However, this isn't easy to accomplish for a number of reasons. To begin with, the patient and analyst start their relationship as strangers, and as a result, it can be very hard for the former to trust the latter enough to give them unfettered access to their thoughts. This is made even more complicated by the fact that someone who seeks analysis likely has been dealing with neurosis for a long time, and unfortunately, more often than not, has had negative interactions with mental health professionals. The result of this second aspect is what Reich calls the narcissistic barrier, constructed to defend the ego or self against being fragmented by those negative experiences. Getting rid of this is seen by him to be a necessary precondition for a successful analysis, and can be approached from two directions. The first, and at least in his time the most common, involves instructing the patient and essentially persuading them. The goal here is to create a positive transference, or a relationship between the two sides of the analysis built on feelings like trust, admiration, and love. However, as we've seen in earlier episodes of the series, positive transference is deeply risky, often lapsing into things such as disappointment. This first direction is thus very uncertain, and, quite frankly, uncontrollable in many cases. Compared to this, the second path Reich proposes is much more secure, although with the caveats that it's also more complicated and cannot be applied to all patients. The trick here is not to instruct patients directly, but to guide them with interpretations. It's the ideal goal, albeit not always feasible. Whilst an analyst taking the first approach might explain to a narcissistic patient that their use of highly technical language harms their own treatment. Someone taking the second approach would rather seek the why directly. Without directly intervening, they would wait until they figured out a contemporary reason for their patient's behaviour. Then, with that in mind, the analyst would consistently interpret those elements to influence the patient without having to deal with the traps of positive transference. As Reich states,
in contrast to the first, this second approach is entirely in keeping with the principles of analysis.
Changing focuses a bit now, it's here that he actually begins talking about the character and its defenses, the subject mentioned in the book's title. For Reich, a character resistance is something that slows or hampers analysis based on form rather than on content. To phrase this another way, oftentimes resistances manifest in ways like lying or giving too little detail, where what's being said is what affects treatment. Character resistances, however, take the form of mannerisms. Maybe they're overly polite, for example. It's absolutely possible for two people with different characters to have the exact same content, yet still express it in completely different ways. It all comes down to the ego and the way it reacts to situations. This brings us to the next section we'll be examining today, titled, Where do the character resistances come from? Reich begins by discussing the division between character neuroses and so-called symptom neuroses. In his eyes, the difference is largely in the name. Symptom neuroses have, specific symptoms, whilst character neuroses don't. However, he also adds that they aren't quite on equal footing. Symptom neuroses stem from the character too, just in a specifically concentrated way. Going further, he stresses that, in character analysis itself, it isn't too important whether the neuroses afflicting a patient is chronic or acute. This is because, no matter if it fully emerges in childhood or during adult life, neurosis always stems from a neurotic character that is ultimately developed early in your life. Problematizing the division between symptoms and character traits, Reich states,
since the symptom formation does not hold up as a descriptive characteristic, we have to look for others. Two which readily come to mind are illness insight and rationalizations.
Focusing on the first, whether or not a patient is aware of their illness, is a pretty useful indicator for figuring out if you're dealing with a character neurosis or a symptom neurosis. Generally, in the former, the patient isn't really aware that what's happening is abnormal or that they are sick. To use a phrase that Reich doesn't, character neuroses are ego-syntonic, meaning that they largely match up with the patient's sense of self. However, once symptoms emerge, like pathological blushing for a hysteric, or compulsions for an obsessional neurotic, the situation shifts to become ego-dystonic, creating a feeling of illness within the person dealing with it. This is all nuanced by the fact that certain symptoms are considered to be almost normal, leading to a lack of awareness. Moving on to rationalizations, a symptom can usually not be made to make sense in the same way that a character trait can. Hysterical vomiting and obsessional neurotic intrusive thoughts are examples that Reich gives. You can't just write them off as that's how I've always been, at least in a way that wouldn't be seen as absurd. Continuing this strand of thinking, Reich explains that such sayings ignore the fact that the character develops in specific ways for specific reasons. In the nature or nurture debate, he falls firmly on the latter side. Shifting gears a bit, all this isn't to say that there's some sort of firm dualism between the character trait and the symptom. Rather, it's often the case that a symptom becomes ingrained within the character in some way or another. Focusing on obsessional neurosis again, Reich describes how compulsive counting can become entirely subsumed into the system of a character who sees themselves as requiring orderliness and being methodical. When this process occurs, the symptom might be chalked up to simple eccentricity by others, illustrating just how flexible the category of mental illness can be. Summing up his argument, our author describes that, although sometimes difficult to fully differentiate, the separation of character traits and symptoms is still useful. It's with this that he turns his attention towards another way to approach them. Namely, as Reich says,
in the process of analysis, it is shown that, In terms of its meaning and origin, the symptom has a very simple structure compared with that of the character trait.
This comes back to our earlier reference to the way the symptom is built on the basis of a character. The deeper you explore it, the more obvious this becomes. In this way, Reich says that it might be possible to gain access to the reaction basis or core of the character through an investigation of a symptom itself, revealing the unconscious attitudes that give rise to it in the first place. Zeroing in on hysteria, the hysterical character, in his eyes, stems from a multiplicity of desires that pull in different directions. This manifests in specific attitudes, which are more difficult to explore than, say, the symptoms of vomiting and blushing that we talked about earlier. However, both ultimately find their basis in past experiences and, more theoretically, in the drives that organize how and what we desire in the first place. Going back to the simplicity of a symptom, all it really reveals on the surface is the aftermath of a specific event or desire. The character, on the other hand, constitutes a whole mode of existence for the patient. It expresses the whole of a person's past, with its traits taking years to fully develop and forming the basis on which the aforementioned symptoms make themselves apparent. This is where his infamous concept of character armour comes in, although with a lot less biological baggage than it would eventually carry. Here, he defines it as a kind of compact defense mechanism against treatment, serving two main purposes. On the one hand, the character armour protects the patient from external stimuli. On the other, it acts to try to master desires under the ego. In the process, it develops a kind of equilibrium that, although neurotic, seemingly protects the patient. In treatment, the analyst is essentially seen as a threat to this armoring. It's thus that Reich holds that the narcissistic or self-protecting defense mechanisms of the ego are rooted in it, giving each individual case its own unique elements. Ending this section, he says,
If a person's mode of behaviour represents the result of a total development, then it must also be possible to deduce the technique of character analysis from that behaviour.
It's with this that we get to the final section we'll be looking at today, titled On the Technique of Analyzing the Character Resistance. Reich begins by returning to the idea of the importance of form over content. Everyone knows about the value of Freudian slips, dreams, and so on in psychoanalysis, but the way in which those actions occur and are expressed is also deserving of attention. Even when a case doesn't seem to be progressing because the same things are being said again and again, that very feature offers itself for analysis and interpretation. It's thus that, for Reich, it's an analyst's own fault if they feel there's no material being generated by the patient. In order to demonstrate this, he offers the hypothetical example of two patients suffering from premature ejaculation, and how that character would influence treatment. In both cases, he says the content is roughly the same. Their ailment is psychosomatic and stems from a fear of castration that additionally manifests, largely unconsciously, as a hatred of their fathers. The one patient has what Reich terms a passive feminine character, whilst the other is phallic aggressive. For both, they form a negative transference with the analyst, insofar as they take the role of their fathers. In the case of a phallic aggressive, this is directly obvious. He berates, insults, and threatens his analyst. However, in the case of the passive feminine, it's a little less clear-cut. Instead of showing anger, the patient seemingly becomes more trusting and devoted to the analyst. As Reich himself says,
Naturally, the character of the passive feminine type is more dangerous, for he works with devious means.
Although it may seem more accommodating and more frank, the patient with this character hides his hatred of the analyst in such a way that it's difficult to uncover and work through. In Reich's eyes, this is why it's so important to look at form instead of just content. Many analysts would probably be overjoyed to have such a devoted patient, compliantly providing more and more material to be interpreted. However, as long as they don't recognize the traps that come with this supposed luck, they are incapable of actually helping him. Moving on, it's time to dive a bit deeper into the idea of character armour. Giving a more technical description, he says that it's ultimately the molded expression of narcissistic defense chronically embedded in the psychic structure. Unlike what I suppose we would call regular defenses, which deal with particular bits and pieces of material, this armouring constantly resists treatment. Hence the idea of specific character resistances like we've been discussing. On this new basis, Reich offers what basically amounts to a summary. To begin with, this kind of resistance, again like we've been saying already, is about form. It's a question of how someone acts, not of what they do. Likewise, different characters present the same material in different ways, like the passive feminine and deception, versus the phallic aggressive and cruelty. With this in mind, it's just as possible to resolve character resistances as regular ones. Additionally, unlike say transference-related defenses, they persist in everyday life. This is why Reich characterizes them as being armor against the outside world, along with against the id or the source of unconscious desires. Another important feature is that, if you go far back enough, it plays the same role in the contemporary situation of treatment as it did back when it was first developed during infantile life. Turning now to the economic viewpoint, we can say that the character armor essentially involves creating a sort of dam where mental energy gets bound up. In the process of loosening it, this energy is able to flow more smoothly, giving analysts better access to those infantile experiences that determine the character in the first place. Now, Reich asks,
how do these facts bear upon the analytic technique of character analysis? Is there an essential difference between character analysis and the usual resistance analysis?
His response is that there are two things at play. On the one hand, you have the sequence in which material is interpreted. On the other hand, you have technique itself. Concerning the former, Reich explains that, while some analysts might object that it violates the rule that the patient must guide analysis, it's still necessary to organize how you approach what the patient provides. As we looked at last episode, you can't just go with the flow, because material doesn't surface in a strictly linear way. It's a bit of a jumble that you have to wade through before you get to actually helping them. Moreover, selection always happens, no matter if you want it to or not. The analyst is a person too. It's just a question of being aware of what is being selected. It's with this that we get to the latter aspect, the technique of character analysis versus traditional resistance analysis. There are a couple things to clear up here, starting with what it means to single out and consistently analyze the character resistance. Basically, this doesn't mean that the analyst tries to get the patient to act less aggressive, distrustful, what have you. Instead, such demands are seen by Reich to be completely pointless, and to an extent, even harmful for treatment. The focus is ultimately on the why. Why is this patient cruel? Why is that patient so polite? There's no big difference in how active a character analyst is compared to a symptom analyst, with the exception that the former is more focused on specifically interpreting that why linked to character traits and demonstrating their existence to the patient again and again, not demanding anything from them per se, but helping them break free of the influence of the traits. A big deal for character analysis is insight, like we saw earlier. By interpreting traits in the way just described, it's possible to get the patient to gain a better understanding of what's going on, eventually leading to the things being interpreted gaining the status of something alien. The result is, more often than not, a kind of change in behaviour, at least for a time. This stems from what was once hidden by the character resistance coming to the surface, like the hatred hidden by devotion in the case of a passive feminine character. Bubbling up, his attitude may become aggressive, although tempered by the anxiety surrounding the threat of castration that originally gave rise to symptoms. With this, we get to the heart of neurosis. Caveating this all, Reich states,
Let there be no illusions, however. The isolation and objectification, as well as the analytic working through of such a character resistance, usually takes many months, and most of all, steadfast patience.
With that said, analysis speeds up immensely once a breakthrough is made. Ignoring the character, although tempting, often leads to confused or chaotic situations where nothing ends up happening. At this point, Reich goes on a bit of a tangent, considering the fact that it's possible to deal with resistances without knowing their infantile origins. The main takeaway is that analysts have to be careful when analyzing deep material from childhood, since if a character resistance is not already worked through, it's very difficult to achieve any progress. With this, we finish the first few sections of Chapter 4 from Character Analysis by Wilhelm Reich, having gained a greater understanding of concepts like that of a character itself. I truly hope you enjoyed or learned something, and if you feel I got anything wrong or wasn't as clear as I could have been, please do feel free to let me know in the comments so I can do better. Next time, we'll most likely be continuing this book. Until then, bye!